That's what we like to hear these days, especially in this new Zoom world that all of us are in. So again, my name is Warren Hall. I'm a manager of support services at the American Liver Foundation. And part of the mission, as you'll see on our leading slide here, is that the American Liver Foundation's mission is to promote education, which is what we're doing here today, advocacy, which we'll be doing actually in a few weeks, and I'll say a word about how you can help us with that, support services such as our helpline and other available resources for people, and research for the prevention, treatment, and cure of liver disease. The American Liver Foundation offers research awards to scientists and doctors who are working to find cures and treatments just in a way that we're going to learn about today in the area of viral hepatitis, something that was so difficult just a number of years ago to treat and to address. And nowadays, we're happy to say that it is something that we're able to deal with. So I'm going to share my screen here. Okay, so there's my slides. Okay, so there you see the mission that I had just mentioned about what the American Liver Foundation does, and we're grateful to all of our sponsors and for all those people who help us to be able to continue this mission. Okay, I'm just going to wait another few seconds until because I do still see some other folks coming in. Okay, so before we get into the meat of our presentation today, it's always good to know what does the liver in its full functioning, what does it do for us? Very often we really don't pay much attention to the liver, and maybe there's some reason for that. Until something goes wrong. But that's true of most illnesses. It's not until we ourselves are diagnosed with something, or a loved one, or we hear about someone, and then that puts it into our mind to look into and see, okay, so just what is this all about? And that's certainly true in the area of liver disease. So we don't really think about our liver. I often say that it's just like breathing, right? We don't even think about it. It's just something our body normally does. And so this is true of our liver. So we'll see here on our slide here that the liver, the main thing the liver does is it acts as a filter. So everything that we take into our body, things that we eat, things that we drink, even things that we rub into our skin, that's something that is not often talked about. Things we breathe in, you know, certainly with smoking, but things that, such as if we work in a, say, a chemical plant or something like that, we need to be careful because the things that we're breathing in, or even pollution, all of that gets into our system, our blood system, and all gets filtered through the liver. And so we see there, not only does it filter through there, it gets processed. And what that means is that the liver is always going to try to pull out nutrients, to pull out vitamins, whatever it is that we're digesting, whatever it is that's floating through itself, through the organ, is going to try to pull out what is good and helpful for our bodies. And we'll see here that part of that, when it pulls out proteins and nutrients, it helps to build our muscles. It helps to make bile. Bile is that awful tasting fluid that sometimes if we vomit or whatever, we might get a taste of that. But that's what bile is. And bile is that acid that's used to break down food. Through the bile ducts, the liver forces the bile into our stomach, into our intestines, and there it breaks down the food to help it to properly digest. Also, because the liver is involved in the production of blood cells, We have the clotting factor, and so the liver is involved in that as well. And the killing of germs. So what the liver is able to do is not only does it try to pull out of the things we eat and drink and breathe, not only does it try to pull out the good things for us, but it's also going to try to pull out the bad, the toxins. We're going to know those as ammonia. They become ammonia. And that's why you see here in the final bullet here that it detoxifies substances that are harmful to our bodies. And so you can see that the liver is a pretty busy organ. The other thing I always like to talk about, and what I find fascinating about the liver, is that the liver has two very unusual characteristics, and they're very important to know. The first characteristic of the liver is that it's the only organ that has the ability to heal and to regenerate itself. And so what we mean by that is that, really throughout our lives, because of perhaps of our diet, because of sometimes with our lifestyle, we're damaging the liver in some way. And so what the liver, though, is able to do is, even though we're damaging it, it's always trying to regenerate itself. It's always trying to heal itself. And that's important because of the fact that if it didn't have that ability, we would have liver disease much, much younger in life. If the liver was not able to heal itself and to, regenerate those cells that are dying or being killed off by things that we're doing. And so that's an important, interesting aspect about the liver. That's why also that liver disease itself progresses very slowly. And it's because of the fact that even though there's some damage there, it's healing and regenerating. The challenging part of this is that that ability does not last forever. And so whether it's due to our age or some chronic health conditions, the liver begins to lose that ability. And then that's where we're beginning to see things like whether it's fibrosis, which is now the hardening, right? The liver is a nice squishy sponge, but now it's getting hard. And also we're starting to see cirrhosis, which is probably one of the more well-known liver disease. And that's where now the liver is getting scarred. It's no longer that nice, smooth sponge. It's scarring. It's even breaking apart in a lot of ways. And so that's when that's occurring after the liver no longer has its ability to try to heal itself. The second point about the liver that's interesting is that it does not have any nerve endings. And so what does that mean? It means that it doesn't experience pain. Now, that's a good thing because as we're talking about so much through our lives, we're kind of beating up the liver and we're not feeling it. And so that process of healing and damaging and healing and damaging, all that's occurring without us even knowing it. That's going to become problematic, though, because when the liver does get to that point where it's being damaged, we're not going to know it. And so therefore, that's why at the Liver Foundation, many of our public service announcements and many of the people that we talk to, we're always telling them that you have to be screened for liver disease. And what screening means is that you have to go look for it. You can't wait until I have a symptom, or I can't wait till my skin begins to get yellow, or before I do begin to have pain in the abdominal area. Because by that point, if it's liver related, it's going to mean that the disease or the damage has moved along pretty well. Some people who have dealt with viral hepatitis throughout their lives, they're always checking their liver because, as we'll get into in a few moments, the viral hepatitis A, B, C, what it will do is it will continue to damage the liver in some ways. And so here you can see this is a nice soft squishy sponge liver on the left. It says healthy. It has that pinkish brownish color. And then next to that, we're going to see a very damaged liver. And so This is what I'm talking about when we talk about the liver now losing that ability to heal itself. This is when damage is going to begin. We usually talk about liver damage in 4 stages. Fibrosis will be spoken of in 4 stages. Cirrhosis is spoken of in 4 stages. And quite often it begins with fatty liver. Sometimes people will say, oh, I just have fatty liver. But that's important because we don't want that fatty liver to progress into anything else. Also, we don't want if the viral hepatitis is affecting our liver, we want to be able to catch that before it gets along too far. So this just gives you a sense of how liver disease goes from being a nice, healthy liver until it gets to the point where it's damaged. So what does damage liver? Viruses, and that's the point of our discussion today. So viruses, we know a lot about viruses these days, don't we, because of COVID, and we'll get into a little bit about that and how what we've been learning about COVID, or what the general public has been hearing about COVID, has helped in their understanding of viruses, and including viral hepatitis. But so viruses are things that can create problems for our liver, specifically B and C. Genetics. You know, when medicine, when you go to see a doctor, and if you're experiencing something that is not readily seen or found, you know, medicine is a series of finding what your illness is not, right? It's a process of ruling out. So that's why sometimes the testing, you know, can be a bit overwhelming, because they're looking for so many different things. But that's how medicine works, though. You keep looking to see, well, maybe it's this, maybe it's that, and then each time you're able to rule it out, then you know you need to move on to possibly the next aspect of the disease that maybe will give an insight into what it is. When all else fails, we're going to look at genetics, okay? And that means that, just as the word genetics entails, it means that there are certain things, along with our good looks and our hair color and so many other things, unfortunately, some health issues can be passed along through our genetics, and liver disease is one of those. This is why when you go to a doctor, they're always going to want to know your family history, right? Your parents, how was your parents' health, and how were their siblings' health? You know, if your parents are deceased, how did they pass away? What are the issues? Because all of that is going to inform the physician's insights into your own health. It's also important to know for your own children's health, because if there is any health-related issues that you are dealing with, depending upon what they are, of course, there is the potential of passing them on to your children. This is true of a couple of the more rare liver diseases, but it is something that we want to be conscious of, and liver disease is one of those things that can be passed on through genetics. Autoimmune disease. We know our immune system is the thing that protects us. When all things being equal, it protects us from challenges outside of our bodies. However, in an autoimmune disease, it's our own immune system detecting something within ourselves that for some reason, or a very complicated medical reason, is viewing it as a danger to ourselves. And one of the autoimmune diseases is one where our immune system sees our bile ducts as being foreign bodies, or for some reason it views the bile ducts as something that is an enemy, so to speak, and begins to attack that. We have PBC, PSC, autoimmune hepatitis. There's some other rare diseases that have to deal with that. But for our discussion today, just know that autoimmune disease can be a cause of liver disease. The one thing that always comes to mind when it comes to liver disease, of course, is alcohol use. And without a doubt, alcohol use is a primary cause of liver disease, but it's not the only one. And so there's a great stigma around liver disease and alcohol use. And part of, again, what the mission of the American Liver Foundation is that we're trying to get over that stigma, that just because somebody has liver disease, it doesn't mean that it is due to alcohol use. And you know what? But if it is, we deal with it, right? That doesn't, we don't look at people when they have illnesses, or we shouldn't look at people when they have illnesses in any accusatory way. What we want to do is we want to deal with the illnesses. So alcohol use, yes, indeed, it is a primary cause of liver disease, but it's not the only one. The one that probably is more affecting people has to do with our diet and our weight. Certainly, poor diet. Remember what we said, the liver is acting as a filter. And that means not only are the good nutrients and the nutrition being filtered through, and our liver is loving it, it's pulling out all those nutrients and vitamins, but so also are the additives and the preservatives and the sodium and the hormones, right? All the stuff that we find in our food supply, especially these days, all of those things can contribute to fatty liver, which, exactly as the name says, it means there's fat in and around the liver, and that begins to damage the liver itself, as well as those things such as the salt and sugars almost acting corrosively to our liver. So poor diet and our weight is going to be something that could be markers for us to know if we have the potential for liver disease. And finally, one that we have learned a lot about and now are addressing it is reactions to medications, to street drugs. We'll talk about that in a little bit. And toxic chemicals. Of course, in that we think about somebody who works at a chemical plant or, something like that. But we also have to be careful of the chemicals we may even have around the house. Chemicals that we use for cleaning, because again, if we're breathing those things in, if we're getting them onto our hands, that's why we should always wear rubber gloves when dealing with some of these heavy duty cleansers. Those things are getting absorbed and they're passing through our liver and therefore can contribute to that. And as you see there are about 100 different liver diseases. Some are very rare, but they do happen. If you want to learn a little bit more about that, check out our website, liverfoundation.org, and we have a listing of many of these liver diseases and some of their causes and some of the treatments for them. So before we really get into this discussion of viral hepatitis, there's a couple of, we think it's always good to have some terminology. So virus, we know what that is because we've heard a lot about it, especially over the past year. A virus is a tiny germ that's made up of DNA, RNA materials, and it has this protective coating, which is what makes it so dangerous to us. And when that virus enters our body, however that happens, it begins to attach itself to our healthy cells and then begins to duplicate itself, it multiplies, and then it begins to overtake the healthy cells. And depending upon what type of virus it is what part of the body it will affect. So when we're talking about viral hepatitis, A, B, C, those germs, those tiny germs over time have the ability to attack the liver. So there's something in the DNA, in the makeup, physiological makeup of our liver that attracts that virus. And that's why people who have chronic hepatitis B or hepatitis C that's untreated, they can develop liver disease. That's why the American Liver Foundation is involved in the discussion of viral hepatitis. Acute infection. So the way to think about this is acute means something quick, something short term, whereas a chronic infection is going to be something long term. Okay, so as we're going to get into a discussion, hepatitis A. Hepatitis A is going to be an acute infection. It's going to be something that could last a few weeks, few months, but that's about it. Chronic infection could be hepatitis B, chronic hepatitis B, or hepatitis C. Those are chronic, means that they're going to be longer lasting, and in some cases uncurable. An antibody is something that our immune system produces to attack when it discovers a foreign germ that has come into our body, and that's our defense system, right? So the antibodies are what are produced, and they go after anything foreign that's in our system. If our immune system is strong enough, and if the germ, the virus, is small enough, our immune system will take care of that. If the germ that has entered our body is too strong, such as with the COVID-19 virus, our own immune system doesn't have the, in many people, in some people it does, but in many people, it's not strong enough to fight this particular virus. And so our antibodies are going to be used as our defense system to try to do that. If it's not able to, then that's where we have a vaccine. So what a vaccine is, it's like help to that that army that we have in our bodies, in our immune system, to try to kill or to try to eradicate that virus or the thing within us that has the potential for causing harm. Okay, so so here is the kind of the meat of our discussion. We are going to talk about hepatitis A, B, and C. Now, something that I probably should add to that slide that talks about terminology is the word hepatitis. Now, hepatitis, the word itself has two meanings. So first of all, HEPA, so anything HEPA is going to be liver related, okay? Hepatitis, the doctor who handles it is a hepatologist. An area of the hospital that specializes is going to be hepatology. So anything HEPA is going to mean liver related. Now, in and of itself, the suffix titis means inflammation. So just the word itself, hepatitis, means liver inflammation. Now that can be something that is a disease in and of itself. Fatty liver, we talked about fat that's in and around your liver. If that fat is not reversed, it begins to irritate the organ, the liver organ, and it begins to cause some inflammation. That's hepatitis, okay? So we have to be clear, though, that in our discussion today, we're talking about viral hepatitis. So we're talking about hepatitis that could potentially be caused by a virus. Okay, so if somebody were to contact our helpline at the American Liver Foundation and say, what causes hepatitis? We'd have to ask them, well, what specifically are you talking about? Are you talking about viral hepatitis, ABC, or are you talking about inflammation of the liver organ itself? Okay, so for our purposes here today, we're talking about viral hepatitis. So the three main viral hepatitis strands that we see here in the United States and in most parts of the world is going to be hepatitis A, hepatitis B, and hepatitis C. Now, just like the COVID-19 virus was not known prior to a year ago, right? We call that a new virus. Hepatitis C, although it seems like it's been around forever, hepatitis C was only discovered or named in the late 1990s. As a matter of fact, this past year, the researchers who did that received the Nobel Peace Prize for medicine and research. If you check out our YouTube web pages, you'll see some interviews with those physicians about their discovery or their naming of this hepatitis C virus. Prior to the 90s, it was simply known as non-AB. So they had identified what hepatitis A was, they identified what hepatitis B was, but there was this other one, and they didn't quite have their medical arms wrapped around it. So they called it non-AB until they were able to further identify what it was, and they named it its own strand. And so that's the hepatitis C. So, here, this is just a quick look. We're going to get into a little more detail about each one. So hepatitis A, how does that spread? Hepatitis A is usually carried through contaminated food or some bad beverages that we might drink. It has a lot usually to do with sanitation or lack of sanitation. So hepatitis A is prevalent in places that don't have strict sanitation, but it also can happen in the finest of restaurants around the world, or it can even happen in our own kitchens. That if there's any type of contamination that contain this, where the hepatitis A virus forms, and we ingest that, then we are going to be infected with this virus. So acute or chronic, remember acute, quick, chronic, long term. And so hepatitis A is going to be an acute affection. And what that means is that you're going to get sick for the most part. You're going to get sick, but your body's own immune system will be able to take care of that. Can I be infected more than once? The answer is no, because what happens again, another unique thing about our immune system is that once our body identifies a foreign substance, so let's say in this case here, hepatitis A virus enters our body, our immune system recognizes this as being a foreigner. And so what it does is our immune system automatically creates these antibodies to specifically attack that virus. And so once that happens, not only is that particular virus eliminated, or whatever phrase resolved, whatever phrases we may want to use there, but then those antibodies will now be present in our immune system, and therefore, if we're come in contact with that hepatitis A virus again, we're not going to be infected with it because our body will now immediately recognize it and resolve it. There's no, you can be vaccinated against hepatitis A, and we certainly do make that recommendation for everyone because you don't want to get sick from this. And so therefore, even though it's an acute infection, health, preventative health is very important. So hepatitis B, and again, we're going to get into a little more in depth. Hepatitis B is a little bit more involved with some exposure to infected blood or bodily fluids. So it's a little more intimate contact that we would have with people. So someone who has contracted this hepatitis B virus has the ability then to pass that on. And so it's passed on through, if a healthy person comes in contact with affected person's blood or bodily fluids through some intimate types of contact, then they themselves could be infected. So when it comes to, is this acute or chronic, it could be either. And so what we mean by that is that for over 90% of the population, when we contract hepatitis B, our own immune system will resolve it. Our own immune system will take care of that in the same way that it takes care of the hepatitis A. But there are those individuals whose immune system is not going to be able to resolve the hepatitis B. And that could be for any number of reasons, other illnesses that someone may be dealing with, autoimmune challenges, or their immune system just isn't strong enough. In that case, the hepatitis B is going to become chronic. And what that means is that it's not going to be able to be cured. Now, the challenge with this is that, as we said before, some of these viruses are able to attack our liver. And so if the hepatitis B virus is not going to be cured, if it's going to be chronic, Well, then what do we do so that it doesn't create other health problems for us? And thankfully, the answer is that there are medications for this. Now, unfortunately, the medications do not cure hepatitis B, but they can prevent the hepatitis B virus from creating any other damage in our bodies. So that's a good thing. Same thing that you cannot be infected more than once if your own body's immune system has taken care of this. And there is a vaccine for this. And so once again, we always recommend that folks get vaccinated for hepatitis B because, just like COVID, we might contract the virus, our body might immediately take care of it, we're good to go, or it could be more problematic than that. And so to avoid any of those issues, we always say that people should be vaccinated. Finally, and the most challenging, is hepatitis C. Now, I say the most challenging because of two things. One is the way you contract it, and that is through direct blood-to-blood contact. So that means that the healthy person's blood has to come in contact with the infected person's blood, and then in that contact, the virus is transmitted from one person to another. And there's various ways that could happen. It's difficult, but there are ways, and again, we'll talk about those in a few minutes. Now, unlike hepatitis B, where the majority of people, their own body takes care of it, it's the opposite with hepatitis C. And that is that the majority of those who contract hepatitis C, their own immune system is not going to be able to resolve the hepatitis C virus. And so therefore, they have to do something about it. Thankfully, over the past 4 or 5 years, the newer medications that have been developed are very effective now in curing hepatitis C. And we always recommend or we always strongly suggest to people that they go get that treatment. You've probably seen many of these commercials on TV as they are all over the place. I'm in New York, and we certainly see those commercials being played here. And there's a few of these. Prior to these medications, and perhaps some of you who are out there listening and involved in this webinar today, perhaps you tried to address your hepatitis C years ago. And it was a very different experience because of the medications that had to be used or were trying to be used. It was almost like chemotherapy that somebody would do for cancer. It was something that people had to experience for many months or more than a year. And in many of those cases, people stopped because it was just too difficult. And as they say, the treatment was causing more challenges for them than the virus itself. And so thankfully now we do have the medications to do that. I should jump over here. Can you be infected more than once with Hep C? The answer is yes. So if you've been cured, it doesn't mean you have the antibodies that will prevent it from happening again. You can be reinfected with hepatitis C. And unfortunately, at this time, there's not a vaccine yet. And so that's still being worked on. Hopefully that day will come, but we're not there yet. Okay, so this is just a little more detail. And I do want to, at one point here, we'll get to trying to answer some of your questions that you may have about these, the 3 viruses that we're talking about today. And so you could see here are what we kind of talked about. Okay, so for hepatitis A, it can be found in blood, it can be found in our fecal matter, in our stool. Contaminated surfaces. So like I mentioned about, restaurants or food preparation places, if they're sanitary or if they're cleaning of their things they use, their pots, their stoves, their countertops. If that's not up to speed, then the hepatitis A virus can live there for quite some time. You can even see here that even for a number of months. Boiling, cooking, food is important because that can kill this virus. However, freezing doesn't. So all freezing does is makes it dormant until the food or whatever it is thawed out. So we need to be very careful about that. And how is it spread? Okay, so we just spoke about that. Mostly it's in terms of contaminated food, but then also could be with intimate contact with another person. The cases in the United States of hepatitis A declined because the vaccine for this was found back in the mid 90s. And then, but after that, we began to see an increase in hepatitis A. And so whether that's people had put their guards down or our food preparations have, even though we know that restaurants and food stores all get inspected, it seemed that somehow or other this has been slipping through. And so there we saw an outbreak after 2012. And every now and then we'll see, we'll hear of a restaurant, we'll hear of a grocery store somewhere that had an outbreak of hepatitis A. So it is something that happens, even though we believe, especially in a place like the United States, where we have refrigeration and we have, proper ways of sanitizing water and purifying water, it can still happen. What's going to happen if you get hepatitis A? As I said, you're going to get really sick. Sometimes people will say, oh, I feel like I have food poisoning, right? We're nauseous and we're feverish and all that kind of stuff. Those could be a sign of hepatitis A. So if somebody has eaten at a restaurant, a day or so later, you're not feeling good, or even a few weeks after that, because the symptoms may not be immediately apparent. It could happen over time, but then the suggestion is going to be to go see a physician to see if you have that hepatitis A virus. Again, here, how do we diagnose it? It's done through blood tests. But again, in terms of treating, there's really no treatment. Our own body can take care of that. Even if you have had hepatitis A, the recommendation is still to get the vaccine, in order to really make sure that your body is protected against this. Always, and this is very familiar to us, right? How do you prevent it? Always wash your hands with soap and water often, especially when you're handling food. That's why very often in the restrooms of restaurants you go to, right, you're always going to see the sign that says employees must wash their hands, right? Well, that's a direct point to their employees who are handling food and being involved in the distribution of food, because this can happen. Who should be vaccinated? If you're somebody who is going to travel, well, first of all, everybody should be vaccinated, but who specifically? If you like to go to travel to countries where perhaps the sanitation may not be what we're used to, or food production is not what our own bodies might be used to, you might want to get the vaccine to protect yourself against those things. Okay, so hepatitis B, we talked about this here, where we said 15-25% of people who get hepatitis B, it's going to be chronic, and that means that it's going to create some real problems for them. So again, we talked about how hepatitis B in blood, semen, bodily fluids. Okay, again, the contaminated surfaces. How is it spread? It's through that intimate contact that people can have with one another. If somebody has hepatitis B, a family member or somebody who lives in your home, you want to be careful with perhaps some of the utensils and some things that that person uses, because inadvertently, we don't want to have the virus passed on. We do see that there are certain infections of this in the United States. Once again, it declined very much when the vaccine came out, and so, but it still can be found here in the United States. Not everybody, it's going to talk about, how do I know? See, hepatitis A, you're going to get sick, but with hepatitis B, how am I going to know if I have it, especially when there are no symptoms to this? Like I mentioned before about liver disease, right? Most liver diseases, you don't experience necessarily anything at the outset. And so how are you supposed to know? And so a few things that might be an indicator, that if you begin to lose some weight, if you have a real loss of appetite, or if you have knowledge yourself that you might have been in contact with someone who does have hepatitis B, then you'll want to go get a screening for this. You want to go do the blood test and see if you have the virus, and if so, then you'll want to see if that's going to be a chronic condition or if it's acute and that it will take care of itself. So here again, that's how it is diagnosed. We want people to be sure that that they do get this testing, because again, you want to know that fact if it's chronic or not, because you don't want it to lead to those long-term problems. Again, who should be vaccinated? Again, we believe everybody should be vaccinated. So let me jump now in the interest of time. We're going to jump over now to hepatitis C, because hepatitis C, as we said, is a little more complicated than the others. Mostly hepatitis C is in the blood of the person who has contracted the disease. And again, to spread, it's by direct blood-to-blood contact. But how does that happen? There's the scenario certainly of healthcare workers, right? If people who have been who work in healthcare, who always have to take precautions of wearing gloves and when dealing especially with persons' blood, because it is the possibility of that being passed along, or a needle stick, right? There's always that concern as well. Many of the folks who are being diagnosed most recent with hepatitis C are baby boomers. And so those are going to be people who, like myself, are in their late 50s and 60s. And, when someone of this age group hears that they have developed hepatitis C, the first thought is going to be, well, I've never been with anybody else except my husband, right? That's like liver disease, right? People would say I have liver disease, but I never drank, But what we do is we have the discussion with that person, and we ask them, well, before the 1990s, did you ever need blood? Did you have when you gave birth, did you need additional blood or anything like that? And most often that'll be the case. The person will say, well, you know what, I did have surgery. And the reason is because before the 1990s, the blood supply was not checked for this. And this is one of the positives, I guess you'd say, that came out of the HIV time period, was that the blood supply was looked at much more intensely. And so along with the HIV virus, the hepatitis C virus was found. And so, and since that time, the blood supply is always checked for this. Although you shouldn't wait for a blood test in this way, but people who donate blood, they may get a letter back that says that the hepatitis C antibody was discovered in your blood donation, and therefore we recommend that you go see your physician. And so that's something that is, not the ideal way to find out. Everybody should just go. I know my own primary care physician now is just testing everybody, all of his current patients, including myself. When we have our annual physicals, it's just something that is done in order that people know. Um, Again, how do we prevent it? Well, we have to take great care in coming in contact with the blood of other people. Certainly healthcare workers have protocols that they follow. It can also happen in a way that, if we see somebody, the Good Samaritan, right? We see somebody's in an accident, maybe a car accident, or somebody falls, and they injure themselves and there's blood present, right? Most people there, as I said, their Good Samaritan instinct will take over, and we try to stop the bleeding, or we try to do something, but we have to be careful with that, right? In case we have any sores or cuts on our own hands, that if this person were to have hepatitis C or any other viruses, that we wouldn't want to have that passed along to us. And so we need to be careful in those regards. Those who are people who may use street drugs have to be very careful, with the sharing of needles, because all those needles, when passed around, they have each user's, or whoever the user is, that has their blood in it, and it's a simple way for hepatitis C to be passed along from one person to another. And as you can see, if there is someone in your household who has hepatitis C, you just want to make sure that they have their own utensils, their own razor blades and toothbrush and all those types of things that they use in order that everyone else can be safe from this. And again, who should be tested? Our recommendation is everybody gets tested. It's a 10-minute test that is done to check for the antibodies. In many cities across the country, I know here in New York City, you can get free testing because this is a health department issue. And there are free clinics around. The testing begins by a quick 10-minute antibody test. And if you show negative for antibodies, you're done. It means that there's no virus present, nor have you had contact with the virus. If your antibody test, that first antibody test, shows positive for antibodies, doesn't necessarily mean that you have Hep C. It means that at some point in time, you may have come in contact with it, or you did come in contact with it, and your own immune system has tried to take care of it. In that case, a second test is going to be needed, an antigen test or an RNA test, and that's going to be the test that will then determine if you have the live virus. If you don't, then you have the antibodies and you're good. It means that you do not have hepatitis C. If you have the live virus, then in that case, the doctor would tell you that that is the case, and the numbers of hepatitis C, they'll tell you like your viral load is like in the millions or hundreds of millions. But then your doctor would then prescribe for you one of the newer medications that in 8 to 12 weeks can help eradicate the virus. It's very important to do this because, as we said, any of these, the hepatitis B and hepatitis C can directly cause liver disease. And that's the whole point of looking to see if you have these viruses and then to take action if indeed you do. So as you can see here, our recommendation is to get tested if needed, get treated, and thankfully now there is a cure for this. These are just, again, some facts about states where people may live, where these things are prevalent. It doesn't matter. Our recommendation is that everybody should go and get this testing. It's simple. In most cases, it's free. And it's better to know because in our discussion about the liver itself, remember we said that there might not be an indication that something is wrong. And so you need to actually to go look at that. So overall, just to wind this all up here, how do you take care of your liver, especially when it doesn't always alert you that it's not doing so well? And that is everybody should have regular physicals, regular visits with their physician, get those LFTs, the liver function tests, ALT, AST, GGT. Those are our liver enzyme levels, the first indication of our liver health. If you're somebody who might be an at-risk person for any type of liver disease, then we say that those blood tests get followed up with a scan of some kind. So you want to get a CT scan, ultrasound to literally look at your liver, because most liver diseases are visible. And these simple scans will be able to do that. Review whatever medications you're taking and be very careful with supplements and vitamins and minerals like over the counter, because if you notice on any of those products, it will always say that these claims have not been proven by the FDA. And so therefore you're relying on the person that wants you to buy these supplements about their safety. And so you want to be real careful with that. Your own doctor knows your prescription medications. And these days, even a pharmacist, the way their system it works is it will tell you if this is a medication known to create some liver challenges over time. These days, the newer medications have been formulated so as not to have any negative impact on your liver. Some medications that have been around for a long time have been reformulated in order to do that. But just like those TV commercials for the medications say, your doctor will always check you for liver disease. The single most important thing, if you want to keep your liver healthy, is your diet. Okay, you want to eat healthy, eat food that is clean. By clean, we mean doesn't have those additives, preservatives, and the hormones. I know organics tend to be a little more expensive, but if you can do that, and also look for the little label that says non-GMO. Those are the hormones that often are in poultry and in some other types of foods to either fatten up the chickens or sometimes it's used for other purposes for ripening in some of the produce, and you want to be really careful of that. So just try it. If you have a good health food store nearby, try to look at doing your shopping there and getting the best food possible. The Mediterranean diet, we get asked this all the time. The Mediterranean diet is proven effective for anyone who has any liver challenges. It's also proven effective to increase liver health. And so remember what we said before, that the liver has that ability to heal and to regenerate itself. We can help that along. We can help that ability to last for a long, long time if we're going easy on the liver. And that means by, watching what we're eating, being careful certainly of alcohol intake and for these other things that we have been discussing here in terms of the viral hepatitis. And so here's some resources here. If you want some more information, certainly go to the liverfoundation.org website or contact our helpline. You can do that in a few ways. You can call the 800 number that's listed there. If you go to our website, there'll be a pop-up for live chat. If you want to do that, and I work on the helpline as well as my colleague Donna and a few others, and or you can email us at info@liverfoundation.org, and then if you're able to do that, get as much information as you possibly can, then you're doing the best that you can for yourself and for any family members. being careful with your diet is extremely helpful, not just for yourself, but if your family's eating healthy, you're helping everybody to be able to, have the best liver health as well as best overall health that they can have. If anybody has any questions, there's about 2-3 minutes left. If you want to pop the question into the chat or into the Q&A, I'll try to help with that. One of the questions that we've been getting a lot of is about the vaccines, the COVID-19 vaccines. And what everybody should know is that the COVID-19 vaccines are safe. When we talk about things being formulated, they've been formulated to have no interactions with the liver. So it's not going to either cause liver disease, it's not going to exacerbate a underlying disease that somebody may already have. It's not going to trigger any type of recurrence. The COVID vaccines do not enter your DNA. They're not formulated in that way. You're not given the COVID virus in those. They're completely safe, and our recommendation is for people to get those vaccines. Okay, I'll just go quick through here and see. Okay, so it looks like that's going to be our presentation for today. Again, go to our website. Also go to our YouTube channel, which is where this video in a few days will appear. If you go to YouTube, then look for American Liver Foundation, and you'll see all of our programming. One of the plus sides of the Zoom generation now is that many of our programs that would normally have been in person, now we have videos of them and recordings of them, whether they were webinars or meetings. Most of the other types of programming we do are with physicians, and we always tell people that any medical questions you do have, you should go to your physician. Those of us here at the American Liver Foundation are trying to provide the best possible information that we have for people, but we ourselves are not physician or researchers. We often do have programming that does include doctors and those who are working in these various areas. And again, if you go to our YouTube channel, you'll see many of those. We've done them recently on Wilson disease, on cirrhosis, and a few other things, and you'll be able to see them there. Okay, so that's all that we have today. I want to thank all of you for joining us here, and continue to monitor our website and to look ahead to some of the other programming that we provide at the American Liver Foundation. Please take good care of yourself, take good care of your health, and we'll see you at another presentation soon.